Good afternoon, everyone. My name's Miles Ayling. I'm the Director of Innovation and Service Improvement at the Department of Health, and I'm delighted to have the opportunity to talk to you today. I want to talk about three things. Can't hear me. Is that any better? Is that okay? I'll stand closer to the mic. I want to talk to you about three things today. Innovation and why it's important to the NHS. Assistive technology, telehealth, telecare, telemedicine, and why that's important to the NHS. And a new organisation called NHS Global, and why that's important to the NHS, but also potentially important to partners overseas. But before I do that, just a little bit of background about the NHS. I'm sure most of you will know this, but it's useful context just to set the scene. National Health Service for England was founded in 1948. We celebrated our 60th anniversary a couple of years ago. It's publicly funded entirely through taxation, and services are free at point of use. It's also big, very big, certainly by European standards, but even by global standards. It employs 1.6 million people. That's the third largest organisation in the world, just behind Walmart, just behind the Chinese People's Army, and I think just ahead of Indian Railways. But it is an enormous organisation. It has a budget of 110 billion a year. That's sterling, 165 billion US dollars. If it were a country, and that were its GDP, it would be the 46th largest country in the world. That's the NHS alone, somewhere between Pakistan and Chile. It has 1 million patient contacts every 36 hours. And the real issue for us is it's very complex. The NHS is not a single organisation, it's a brand. There are thousands of independent businesses and organisations that go to make up NHS, from large hospitals through to community centres through to general practices. And it's also seen significant improvements. You're probably familiar with some of the criticisms the NHS faced over the past couple of years, particularly from North America, at very long waiting times, about very poor mortality rates. That's changed in the last decade. Waiting times have been dramatically reduced, mortality rates have been significantly improved, and the quality of care that people receive right across the NHS has improved dramatically. But, it's a really important but for us, there's a significant challenge facing the NHS. Funding over the past decades increased almost threefold, from around about 40 billion to 110 billion. Despite that, demand for services and financial pressures on the system continues to grow. That's got even worse following the global economic crisis. We're not immune to that. I'm sure you're not immune to that. The implications for us are quite significant. We believe we'll face something like a £20 billion gap in funding by 2013-14. That's a huge proportion of spend by anyone's measure. Put another way, from April next year, the NHS is going to be running out of money at the rate of £500 million a month. It really brings it very sharply into focus just what the size of the pressures facing the NHS are. So what are we doing about it? Well, our strategy is to focus on quality and continuing to improve quality, to focus on innovation, to focus on improving productivity, also to focus on prevention rather than treatment. There's a whole strategy that's been built up within the department. It's led by my boss, a chap called Jim Easton, that's focusing on that. And the whole of the NHS, the whole of the Department of Health, which is the body that designs policy for the NHS, is supporting that programme in a way that probably we've not seen for other strategies, certainly in the 10 years or so that I've been part of the department. I certainly don't have time today, probably wouldn't have time in a whole day to talk you through that whole programme of QUIP, but what I will do is focus on those three areas I mentioned before, and starting with innovation. And this is primarily around the NHS, but I'm sure some of this will be the same for health services in India. Why innovate? It's a question I'm often asked. A lot of people just say, well, why bother? Well, firstly, because innovation saves lives and it improves quality. If it wasn't for innovation, we'd still be operating with saws rather than lasers and robots. It saves money and it improves productivity. Not always. Some innovations do introduce cost, but by and large, perfectly reasonable to assume that you can both innovate and save money. certainly the case in the UK that without innovation, costs in the public sector tend to rise faster than they do in the rest of the economy. So what do we do about that? Well, it's pretty clear if we're going to achieve a £20 billion productivity gain in a matter of years, simply doing more of the same isn't going to be good enough. So people often say, well, can't we just get better at doing the same? Well, that's not going to be good enough either. What we need is a radically different approach. To go along with incremental innovation, which is step change, improvements in quality that we see on a day-to-day basis delivered through the NHS, we need much more radical change, disruptive innovation, doing things in a dramatically different way, in different settings, using a different skill mix of workforce. But there are barriers, and that's not going to be easy. You need the right culture and the right leadership for innovation to flourish in any healthcare system, and that was missing in the NHS until relatively recently. We tried to put that right. One of the things we did was introduce a new legal duty to strategic health authorities to promote innovation in the NHS. That's the first time any public body in the UK has had a statutory duty to promote innovation. But it sharpens people's minds. It makes them focus on innovation as an important programme. We need to reward and incentivise people. For too long, people have thought that inventors and innovators are mad people in white coats in laboratories that don't really contribute to the bottom line. And whilst everyone else is working hard, treating patients and delivering financial balance, you've got these people that are off with their mad ideas. Well, that's simply not true. Innovators are going to be the future for the NHS and the future for healthcare services right across the world. You have to reward them individually. You've got to reward them organisationally. We've done that in a number of ways, both formally giving people permission to experiment, but more important, through prize programmes that actually reward people visibly so their colleagues can see the contribution that they're making is valued, not just locally, but centrally. We've got to support and invest people that want to innovate. One of the real difficulties with innovation is that the return on investment often doesn't come for many years. Trying to persuade a director of finance in the NHS to spend millions now on the possibility that he might get a few £1 million return in 10 years' time just doesn't work. Their horizons are much, much, much shorter than that. So what we've tried to do is introduce funding, completely separate from the core funding the NHS receives, to support the spread and adoption of new ideas. 250 million over 5 years. Not a huge amount in itself compared to the NHS budget, but when there was no money available previously, it's a significant step forward. We've also got to get out of our system the idea that it's the job of this centre to spread new ideas, to push new ideas out to the NHS and impose solutions on them, which traditionally has been the approach that the Department of Health would have taken. It would design a policy, it would say, this is best practice, this is the thing that you should be doing, now go away and do it. And a couple of years later, they'd wonder why no one was doing it. What you've got to try and do is encourage a situation where there's a desire for those new innovations, both managerially, clinically, but importantly as well, though, from patients. So there's a pull for new ideas. One good example of that, and what I want to turn to now, is assistive technology, the telehealth, telecare. I've had a couple of conversations already with people from health services in India about the work that you're leading on telehealth and telecare, and very similar programmes in the UK and the NHS. Why it's important for us is that assistive technology will benefit primarily those people with long-term chronic conditions. And there are over 15 million people with a chronic long-term condition in the UK. That figure is projected to grow to over 18 million in the very near future. And 7 out of every £10 spent in the NHS is spent on people with a long-term condition. So a huge proportion of that 110 billion I mentioned previously. More importantly, those costs are projected to rise dramatically by at least another 4 billion over the next few years. Equally, and this is a historical problem, over 80% of all contacts with patients in the NHS are face-to-face. There's a very small amount that's done by web, there's a very small amount that's done by phone, but getting that figure down below 80% is incredibly difficult, and it's incredibly wasteful for people to make trips to see their doctor or to hospitals, and it's incredibly inefficient for the NHS to manage its interface with patients in that way. There are many parts